when I heard from Tom through, like this is what's in over the clerk's office. I called and got Julie, and I asked for somebody to call up Mary Beth. And in that role of answering to the first iPad note that came through, Mary Beth said she would be here.
I think something came up, yeah, at work.
And
Okay, are you ready to start the computer?
Can you all hear us? Just wondering, because I've got this going through the TV.
I think Mr. Collard is trying to speak, but we can't hear him.
I can hear you plain.
Steve, I see you're trying to talk, but we also can't hear you, which is probably on our end.
no, that's not it.
Sorry, we're having a little trouble getting the computer set up, so we'll be just a moment here. Thanks for holding with us and helping be our sound check.
What's it?
You're muted,
Where?
Paul.
Okay, so they can hear us and each other. It's just our sound coming out. Is your computer?
Hearing?
Oh. Let's see.
I think that's actually Ashley.
Hmm.
No?
Mm-hmm. Yeah, could be, yes.
Oh yeah, because I'm signed in here as Parkview.
Hmm.
So pretty tech savvy. I can hear the group and Supervisor Binder, says my caller. How come we can't hear anybody?
What's your look?
Now can you hear us?
Okay, we think we might have it figured out on our end. Mr. Collard or Mr. Binder, would you mind opening up your mic and seeing if we can hear you?
Yes, can you hear me now?
Excellent.
Very loud. Very loudly.
All right. With it. Call this meeting of the Parkview Health Center Committee to order at 2:07. Item number 2 is approval of the October 19th, 2023 Parkview Health Center minutes.
Move to approve.
All right, a motion to approve in second. Any changes?
Yeah, I was looking over the financial report, everything looks fine.
Okay. Then all in favor of accepting the minutes, say aye. Aye. All opposed, say nay. Carries. Item 3, public input. Would anybody on Zoom like to address the committee? If so, please feel free to open up your mic and have your time. Mr. Binder, go ahead.
I'd just be curious, when you go through like the self-pay versus the Medicare pay, what the difference is in pay and why there would be any difference at all. If a person works hard their whole life and saves their money and actually is paying their way for the health care they're getting and the service they're getting, why would they be paying more than what Medicare is paying? And maybe it's the same, I don't know. but when you get to the self-pay, I would be curious what the difference is and why.
All right, thank you so much. Anybody else from the public that would like to address the committee? And then I'll ask one more time if anybody else would like to address the committee. Okay, we'll move on then to item number 4, the financial report.
All right. So. You should have the October month end in front of you. Attained percentage should be about 83%. Looking through revenue. Our Medicaid is running at 91% of budgeted, so that's above average. Our family care is running above also, and that's that one, and the Title 18 and the Medicare Advantage Room and Board, those are running behind just because our census in those categories are lower. Our private pay is a little bit lower than budgeted. And that's because of the census also being lower for that group. Going down, our non-operating grant revenue, that's our S&P money. So that's higher than what we budgeted this year. And that's running about consistent where we had previously expected. The other miscellaneous revenue is that would be our Optum money that we're getting. And that's running a little bit ahead, so we have a few more people on that. Transfers in, that's the tax levy. So at this point, we've gotten to 836,000 of tax levy. The other transfer in was due to the water heater repair being more than what we had originally had thought. Next part, you're looking at total labor, about a quarter of the way down the page. We're running at about 62% of budget. And actually lower than we were last year, even at this point. Total travel, we're up to $12,000, running at 50%. I know there's a few more conferences that are scheduled right now, so that'll be up a little bit more this next month. Capital, we're about 72,000 under budget. We still have the van to pay for yet. That's in there, and that should come in tomorrow. Next category, office supplies are at 68%, so nothing of concern there. Next section is our operating. That's running at 61%, so that's nothing really of concern there. Couple big items, but are big percentages, but they're all small dollar amounts. So nothing there. Repairs and maintenance, we're at 88%, so that one is a little bit higher than where we should be, but we had a couple big early expenditures for some bigger repairs. Some doors and stuff weren't working right. So that's pretty much what's in there. Heat and lights, 78%, so we're still on track yet. Um, In that category, our contractual supplies. We're at 77%. So we're under our projected. And looks like we should be doing okay through the rest of the year on that. Property liability, and that's just an amount that came through from the budget, so that's why it's always sitting usually pretty close to what where we should be. It's just 1/12 of the total for the year. And same with depreciation. So giving us a net deficit at the end of $7,617,000. If you take out the transfer out of the ARPA money, that would give us an amount of $1,064,000 of surplus. So, and our tax levy was $836,000, so we're actually doing better than our tax levy by about $200,000 still. And we had budgeted using $2,296,000 of fund balance, so we are definitely well under that.
So you still apply all of the levy that was budgeted first, right? So
That's that comes in 1/12 each month comes in as a journal entry, so they will keep putting that levy into the account.
so what we run better than is really applied to the reserve fund.
Correct.
Yeah, that'll
if
go
we-
into the reserve. Yeah.
Ran $2.3 million, then would the extra 100,000 roughly fall into the reserve fund, or would the levy would part of the levy get returned to the general fund?
No, that would go right to our fund balance, yes.
Okay, thank you.
Because 1.5 was taken from the contingency fund.
That in 24. That's what we plan, we projected to use in 24 budget. 23 budget, we projected to use $2,296,000. If everything keeps going as planned, we won't use any of our fund balance. And we could end up putting 200,000 additional back into that.
That's good.
Any other questions about the financial report? Okay, thank you so much. We'll move on to the administrator's report.
Okay. All right. So for October, our average daily census was 91. We had 12 admissions and 11 discharges. Of those admissions, 1 came from home, 11 came from the hospital. For discharges, 3 went home, 4 discharged out to the hospital, and 1 went to a different nursing home. And then we had 3 residents that passed in-house. We currently have 30 people on our waiting list. And our summary for payer sources for the month, we had 21% of our residents, or 21 residents on private pay or VA. We had 63 on medical assistance, 64 including developmental disability, 4 on family care, 0 insurance, 10 Medicare Advantage, and 2 Medicare patients. So total residents that we served in October were 101 residents. We also are just about, I mean, this is not really October, but October was tough for admissions because we did have a respiratory outbreak on our short-term rehab neighborhood. So we couldn't admit there. We started admitting there and then we got a COVID outbreak. So we are just about to demask everybody tomorrow at the building, but we've had COVID in the building for 3 weeks, almost 3 weeks. So we did have to limit admissions at one point. So from the hospital, we did take any residents that were out at the hospital setting. They came back. We helped the sheriff with the discharge to Parkview, but other than that, we held on admissions, otherwise outside of that.
What do you mean with the sheriff?
They had somebody that needed end of life care.
Uh, Out of the sheriff's.
Correct. Mhm,
Out of the jail.
yeah. So that's kind of a little update there as far as like census goes and why it is lower than it typically has been in months past. For staffing in October, we had a current staff of 174. We hired 10 people in the month of October. Turnover was 7% this month. We had 11 resignations and 1 termination. Also note that these include people that go from a point status to a casual status as well too. We have a lot more casual staff than we, I think, anticipated this year. I think some of that is part of the CNA program that we have, but you can see in your financials too, I think it's up like 156% for temporary employees. 155% for temporary employees. So we do have quite a few casual status people. Open positions for nurses, RNs, and LPNs is 13. CNAs is 55. 9 hospitality aides. Housekeeping is doing well with no open positions. Food service did hire a couple people this last month, so they're down to 1.3. So probably about 2 people there that they need. And then we had some status changes. So we had 1 CNA who went from 60% to 40, 1 from 70 to 40, 1 from 80% to 60, 1 full-time to 80. We had 2 of those people. We had a nurse that increased her status from 80% to 90%, and then another nurse that increased from 60 to 90%. We had a CNA class that just finished 4 weeks ago, I think. Just last week. We had a CNA class that finished last week, so they should be training on the floor, and they'll be on the floor with us soon. We had a new social wellness manager who just started today. It's her first day. Her name is Taylor Diedrich. She comes from Rocky Knoll Nursing Home, which is also another county nursing home. So she will be potentially here, I'm gonna guess maybe next month for the next meeting. So you all can meet her as well too. So as far as incentive uses goes, I just printed this. But from just comparing from last year to this year, we're actually down about $2,500 from this past payroll from last year's payroll as far as incentives go. So using less incentive. That also depends on the week. I don't want to have I don't want you to have rose-colored glasses on here, but you know, it all depends on the week too. So but but it is pretty consistent from last year. Mhm.
Any questions?
Yes, just a quickie. You said that yesterday was the graduating class of CNA,
Last week,
last week, so. That, I got to put my glasses, that 55.1. Is that included in that 55.1? So that would even be lower.
this should be lower, yes.
Okay.
Mhm.
that would have been, that will be in November.
Yeah.
Information.
It's headed the right direction as well.
Yeah.
Yes.
Morris, anything?
Well, Followed everything right along, we're good.
Yeah, I'll just note, I think like, obviously, month to month, these things fluctuate, but. You effectively lost a full FTE in CNAs just from those shift change or status changes.
Mhm.
So without a person leaving work there, just the ebb and flow, in other months, it's been the other direction or not as extreme, but makes it clear how important, the ongoing hiring and all that, really is, but just, we're better, our RN numbers are, lower, or vacancies are lower, the hospitality aides are lower, the food service is lower, all seems great. Okay. Then, we'll move on to item 5, discussion of the PPO plan and how it relates to Parkview Health Center. So, last week, the board passed a new PTO plan that will.
Maybe it's item 6 is the PTO plan.
Yeah.
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 Did I skip something?
You said, did you say move on from item 5? Maybe I heard it wrong.
Perhaps I did. All right, so we're all on the same page, though. We'll be on item 6, the PTO plan. And I think, this group wanted to get a little more understanding about how it was going to affect different folks at Parkview. We know there's a lot of staff that are on different schedules, and be able to have space if people had specific questions that would help this committee better understand and provide the right oversight for future agenda items related to staffing. So I guess I'll turn it over to the director, administrator, and see if there's anything else you want to say or talk about with it, and we'll have Mr. Collard on to help as well.
Within the PTO plan for Parkview?
Yeah, or how it's gonna affect the different groups of employees you have, or concerns that, anything that, not concerns, but anything that you wanted the committee to be aware of about how it was gonna impact your scheduling or any of the other incentive structures or anything like that.
Sure. So there are 3 additional holidays that will be added to Parkview, which is good because even though they have not been getting holiday pay for it, we've been scheduling those as holidays and putting them in rotation because we know that it's hard to find coverage. So now they'll be getting that holiday pay that they weren't getting previously. So that's good. The staff will like that. That will be more cost to Parkview. Some of the new staff that are coming on, they'll be getting more vacation than they were previously. So when a new staff member was hired, they were only getting half of their vacation the first year. So say they started with 2 weeks, they were getting 1 week. And essentially in this, then they would be getting 3 weeks. So it's 2 additional weeks that they would be getting within the first year. I think it evens out though. Mike, when does it, I think it evened out after 5 years or something like that. Is that accurate?
Well, it doesn't completely even out if you take into account the full PTO combines some other benefits such as sick leave.
Right.
So it evens out if you, at some point, and maybe Stephanie can address the details better than I can. But in principle, it doesn't even out as vacation at any point. But it combines, the sick leave, and we had a less than average number of sick days to begin with. That was a recommendation made by our consultant. The last 2 times we did a pay study was to look at the amount of sick leave and to consider a PTO plan. So it really does increase the total number of days. I'm not sure if there's a break-even point. The break-even point in my mind is what impact will it have on recruiting and retention? Because that's the goal, is to have some impact on recruiting and retention. This really puts us in a strong position with our competition for hiring other organizations, both public and private sector. So if this allows us to recruit even a few more people, that's where the break even comes in terms of reducing overtime costs or being able to increase enrollment. Anything to add to that, Stephanie?
No, you were spot on. What it's combining is, it's not just sick time and vacation, it's also floating holiday and partial bereavement as well. So those are all something to keep in mind. And that's something that we'll be rolling out to, management as well as employees in our, implementation phases as we go through the beginning of first quarter of 2024.
The second, is that, are those 3 holidays, are those added to the bank? The bank of time, or the actual floating time? Or is it?
No.
Separate.
So the way it's worded in the policy for all 24-hour operations, they have a choice. So they can either choose to be paid out for the holiday, or it can go in as a PTO in their PTO bank. I know that Parkview has, indicated that they would prefer it to be paid out for obvious reasons. But we just want to make sure that whatever Parkview chooses, that would just be consistent for all the employees.
Thank you.
Welcome.
And I think the portion of floating holidays that were treated as true floating holidays throughout the rest of the county, those are just being consolidated with PTO as regular PTO days. So we do still have regular holidays, and those are the ones where 24-hour operations have an option that can be followed to pay them out, as opposed to putting them in the bank when they're worked by employees. So yeah, we certainly expect at Parkview, that's where a lot of the impetus came, to allow that option to have it paid out because of the obvious impact on the scheduling.
Does that answer your question?
Yes.
Yeah, so they'll get paid as the holiday occurs, just like they do right now.
If they don't want to take the holiday, they can bank it. Is that correct?
It's got to be a systematic choice for all employees. So it's got to be either one or the other. And that's how we're going to, be able to be consistent with all employees moving forward.
Will that keep all of your employees on the same holiday rotation
Yes. Mhm.
and create more equity than?
Yes.
Those, yeah. Perfect.
Yeah.
Any questions from you?
I have no question. I'm good. I'm good.
Okay. Okay, well, thank you so much for joining us.
You're welcome.
You're welcome. Thank you.
We'll go on to item number 7 then, discussion and action, increase 2024 expensive care self-pay rate. We'll turn it over to Lindsay to tell us a little bit about this first of all.
So last month we have 2 different rates at Parkview. We have one which is the regular self-pay rate, and then we have an extensive skill care, which includes, I've got it listed on the bottom, but it includes IV therapies, if they would need extensive wound care, bariatric care that would be requiring special equipment for them. We currently have these different rates right now, so this is not a new rate that we're doing at all. Our current rate is $370, so we would like to increase it by $15, which is the same rate that we increased the self-pay rate last month. This extensive care rate is for people that need above and beyond, the basic nursing home care. And this is really just due to the cost of care and medical supplies that it takes to take care of these individuals. So just to put this per day in perspective, as 385 does seem like a lot, it does cost the building $402 per day to take care of a resident. So I just want to let everybody or keep that in mind, that this is not making money with this rate. We still are not making enough money at this rate.
Is that 402 an average of all, or just these extensive skilled care?
All residents.
Okay, so
Mhm.
safe to assume that the extensive skilled care residents are
Potentially more.
significant, like,
Yeah,
I mean, because the things you're listing, I'm assuming that those things are not things that, like, the inflation of the last year or so have increased by $15.
right. I mean, these are expensive. I mean, a Peerlex drain itself is $25, and you could be changing that out daily, maybe, or 4 times a week, depending on how much fluid buildup somebody has.
And then, do you know offhand what is the what would the extensive skilled care rate be for Medicaid?
No. Mm-mm.
But it's in the,
So
in the same
very,
ballpark.
and so the new rates that they
Yep.
generators are not just, they don't just give you a dollar amount, it's a combination of what the MDS code is.
Okay.
Yes.
Oh, okay, I see.
And there
So,
could be 20 different MDS codes for this one patient, and so one patient could be a lot higher, or depending
So
on the code.
the Medicare is, each item gets scanned and paid for, and the self-pay is just a all, whatever it takes under one.
Correct.
Okay.
Yep, yeah. Yeah, Medicare and Medicaid is a little bit more complicated. They've got a 4-letter code in which you get paid by, and those 4 letters are all individual categories. So based on how that person scores in each individual category will give you a code which equals a dollar amount.
Yeah, okay. Supervisor Binder, hopefully that answers, gives you some clarity, but would certainly invite you to connect offline to learn a little bit more if you'd like.
Yes, I guess when they do come to personnel and finance, I would still like to know what the cost is for a Medicare patient. I'll ask you the same question I'm asking you today. I know you can figure it out, and it's like, if I'm on Medicare and a self-pay, you have the breaking point, and I know Medicare pays a whole lot less than what the self-pay pay. And I'm curious why. I just, in my opinion, believe if I worked hard my whole life and saved my money, I should pay no more than what Medicare pays. I look at the bills I get from Medicare that they pay about 10 cents on a dollar. So I would venture to say they pay half of what the self-pay pay. And when you come to personnel finance, if you could bring that information with you, because I will be asking you there.
Okay.
Okay,
Oh, actually,
this is Medicaid though.
but that's,
You want to know what Medicare is though, correct?
Correct. I want to know what the difference between a self-pay and a Medicare patient pays. If
Medicare, not Medicaid.
all of them, basically, if there's 3 categories, I'd like to know what each category pays. If I'm basically have no money and I come there, I have Social Security and a pension, what do I pay? And I know like a self-pay is going to pay $385 for this service. All I want to know is what the difference is between a Medicare patient and a self-pay patient, because I hate to see that where the self-pay are subsidizing the Medicare because they worked hard their whole life. And basically we're taking all their money that they could be leaving to their family. And a lot of them could have signed all their assets over to their family and now they would be Medicare patients too. But they basically wanted to pay their way. So I would just like to know what the difference is. Not that it matters, but I would like that information.
Think, looks like maybe that's some information that, we can, they can try to compile.
We can get that for you. Yeah.
I appreciate it. Thank you.
Mhm.
Okay. And then this is an ordinance that that we would need to change. Is that correct?
Mhm.
No?
It's just if, as long as you agree to, approve this, then we can send out the letters letting the individuals know that, or that care that's been approved, that we increased it.
It isn't a budget request or anything
No.
like that. It's just
No.
An update.
Any other questions from the committee?
No, I was just gonna ask, but I'm sure you can't, by the way you explained it. What does that compare to surrounding nursing homes? They have self-care, the self-pay.
Mhm.
Any idea?
I'd say it's pretty comparable to Evergreen.
Okay.
Mhm.
I mean,
Well,
you're not
we're
charging
lower.
more than any
Yeah,
other.
We're still
just
lower.
than-
Yeah, we're not higher than anybody.
It's figured out the same way, whether, whether you're in Evergreen or whether you're here or wherever. For Medicare or for Medicaid, right? The coding and everything is
Mhm.
figured out the
Yeah.
same way.
Yeah.
Yeah,
So,
Okay, I'd say I misunderstood it. I thought if you were
the coding,
self-pay, places like Evergreen can charge more for rental of the unit.
Oh, yeah,
sure,
each, for self-pay, it's different, or
Okay, but
Medicare
the
and Medicaid.
self-pay still follows the same formula.
Yeah,
Mhm.
Oh, okay, then I have no problem.
Last month, when we looked at the self-pay rate, we actually, in your minutes, item 7, you'll see the rates for some of the nearby ones that we took a look at. So historically, these are checked, both at the base as well as, I'm assuming, these extensive.
and this is the base rate, and then in there is the base rate. Each one could have their own add-on rate.
So even at 385 for the extensive care, you can see it's actually pretty comparable to just the base rate at a lot of the neighboring facilities, so. Okay, yeah. All right, then, we'll look for a motion to approve this.
We have enough for one.
We do, we have 3 out of the 5, so that's enough for a quorum.
I'll make a motion, we accept.
Okay,
session.
motion is second. Any other questions or comments? Okay, then, all in favor of raising the 2024 extensive skilled care self-pay rate to $385 a day, say aye. All opposed, say nay. Carries. All right, we'll go to item 8, suggested topics for next time. Or any future meeting, I guess. I'll just suggest, sorry, go ahead, Mr. President. You have some,
Are you asking whether or not the date is good?
well, first I'll ask if you have any suggested topics for a future item. Or for a future agenda.
Not at this time.
Okay, I'll just suggest that as we, probably not, doesn't make sense for January, but maybe, I don't know, at some point in the future would be nice to just kind of come back to the PTO plan and
okay,
hear how it's affecting things, so
okay,
whether that's, whether, and I don't know when. I'll leave that to you, but sort of
Okay.
like, whether we have a pulse check on the, recruitment and
Okay.
retention, or if. We get through a few of these holidays, with this plan in place and things are running better or something like that. I
Okay.
just think any, feedback from your end, would be helpful.
okay.
You don't think that we need Mark or anybody from Human Resources?
I think
step in at a later time.
I think if we do, we could certainly invite them. I think we had Stephanie on. Today, and I know she worked very hard on the plan. But certainly if anybody feels differently, we can. We have this great technology that we always get working eventually and,
Sure.
allows for pretty easy participation from others if we need it.
I'm thinking the plan starts in January, so maybe if I follow up in March or even April
Yeah,
for a first quarter report.
that'd be great.
Okay.
All right, then it looks like our next regularly scheduled meeting would be January 18th, at 3:30. Decided, December, with the way the third Thursday would fall, just kind of made sense, to cancel that meeting for folks. So is that date good for folks?
January 18th,
January
Okay.
18th,
put it in there and see how it floats.
all right. And then that brings us to adjournment.
Move to adjourn.
Second.
All in favor, say aye.
Aye.
We are adjourned. Thank you all.